Quite a busy morning list. Who's this?
Mr. Howard.
Hernia repair?
Pancreatoduodenocholecystectomy.
Oh, God. Where's Noble and Flint?
Delayed and casualty. We should wait. This really is a two-man job.
Like so many things.
Nonsense, I can do it without them. Skin marker, please, Terence.
Isn't it normally a vertical incision?
As a Christian. As a Christian, I'm often asked, why does God allow suffering? Why, as I speak, in this hospital, for some, their treatment or surgery is going very well.
Well, it all seems to be going very well.
And yet for others, very badly.
Even I think that this patient has suffered enough.
Well, we did all we could. I'll get Noble to break the news to Mrs. Howard. Terry, you'd better call the chaplain, ask him to administer the last rites.
Body of Christ.
Amen.
Body of Christ.
Amen.
Take one and just pass them on. Excuse me.
I can walk. Father, it's a miracle. I can walk.
All yours, Reverend.
Thank you, Terry.
You only need the last rites, Reverend.
But I can do more, much more, so much more.
Would you like a nice cup of tea?
I can do a lot more.
Mrs. Howard, we're so sorry for your loss. That's the pancreatoduodenocholecystectomy for you, Flynn. Hard to perform, rare to survive. Bugger to spell. Coffee?
In this dirty old part of the city where the sun refused to shine, people tell me there ain't no use in trying. We gotta get out of this place. If it's the last thing we ever do, we gotta get out of this place. Girl, that's a better life for me and you.
Good morning!
All right, Mr. Ron.
Good morning, Sydney. I see we're having our 3 stars repainted this year.
No, they're being taken down. This hospital has been stripped of its 3-star ratings.
What?
Didn't you know? They sent you a letter about it months ago. Look, here it is.
Why didn't you give it to me?
But it didn't say it was urgent.
Sydney, from now on, I want all my post immediately.
You better have this then. Arrived this morning. It's a suspicious package.
Suspicious.
Could be a bomb. It's from Mrs. Howard.
Mrs. Howard?
You killed her husband in theatre last week.
Sydney, that operation was 100% successful. If Mr. Howard had lived, he'd have been delighted with the result. You'd better screen all my incoming post. Meanwhile, I'll sort this out.
Yeah, mustache. I'll take these baby name tags to the maternity ward. May have left it a bit late.
Right. I'm going to go through this one more time. Which one of you is Simon?
Morning, ladies.
I'm not a lady, Dr. Noble. I'm a trained professional nurse.
And a very attractive one at that.
Dr. Noble, you do have a way with the ladies.
Morning, staff nurse.
Don't even think about it.
Morning, team.
Got a forward message for you, Mr. Ron.
Not now, sister. I suppose none of you thought to inform me the hospital was being stripped of its 3 stars.
It's not like someone died, is it? Like poor Mr. Howard.
I don't understand it, Dr. Noble. How come we lost 3 stars in 1 year?
We didn't. Last year's were awarded due to an administrative error.
Administrative error. If I made errors like that in theatre, what would people say?
Oh, for God's sake, Mr. Ron, what are you doing?
Or something like that.
It shouldn't be too hard to get those stars back, but why didn't we get any?
Excessively long waiting list for surgery.
Well, you can sort that out, Noble.
Too many bed blockers.
Flint, that's yours.
And too many patients left on casualty trolleys.
I'll sort that out. We just got to do it before the Department of Health Inspector arrives.
That's the phone message. He's coming tomorrow.
Tomorrow?
At 9.
Right. Well, we know what's expected of each of us. Noble, Flint, be just like me. Task-orientated, completely focused, and drawing upon our intimate knowledge of the hospital. Right. To casualty. Sister, follow me. Casualty?
Can't I just skip theatre? I've got to sort out all the bed blockers. I don't even know how many there are.
Relax, Flynn.
Oh, I know, but we've got loads of long-stay patients.
But Flynn, how long do they have to have been on the ward before they officially become bed blockers?
12 months.
What's the average life expectancy of our long-stay patients?
8 months.
Exactly, so you've just got the one to worry about.
Oh, great.
Yes, Mrs. Portland.
Oh, no, not the chronic leg ulcer.
Yep. Can't shift it or her. She's been on the ward for 17 months. She's a bed-blocking, resource-draining, morale-sapping, treatment-defying, ulcer-festering record breaker.
And all I've got to do is cure her by 9 a.m. tomorrow morning.
No time to lose, Flynn. Nothing must get in our way.
Whoa. Right, Docs.
What's with the X-ray spec, Sid?
I'm using this specialist imaging device to screen Mr. Ron's mail for bombs. It's a bit less complicated than the MRI scanner.
MRI? You do know metal items can't go near it?
Oh, yeah. Now I do.
Those won't work, Sid.
Nah, you're right. I'll get Gasman to ultrasound it in the intensive care unit later. Mustache. Looks like that rib fracture healed up nicely, Dr. Noble.
Old rugby injury.
Yes, but how did you know?
I don't see what all the fuss is about, sister. Just a few patients on trolleys in the corridor. Good God. Come along. I'll call the nurse, dear.
Water.
Right, old chap?
Medicines.
Any time now. You a doctor? I haven't seen a doctor for 2 days.
I haven't seen a doctor at all.
It's a hospital. I thought I was in a hospital.
You're all doing very well. Hurry up, sister. Seems to reach a dead end, sister. At least the patients are quiet here.
That's because this is the dead end.
Oh, yeah.
Hurry up, Gasman. I have a waiting list to cut.
Right, Mrs. Stanley. Time to put you to sleep. Unless you want to feel the pain. Would you like to feel the pain?
No.
Okay. We'll soon have that unsightly, repulsive, hairy wart of your face.
We're actually doing a hernia.
What twisted priorities you have, dear.
Any ideas, sister?
You leave it all with me. I know exactly what to do.
Excellent. Bit of focus, that's all it took.
So what am I going to do about my bed blocker?
Try the internet. Go to a medical search engine, type in the words leg ulcer cure and miracle.
You could try traditional Chinese medicine like my mother. Whenever I had a bad chest or something, she'd brew up a herbal concoction. Ligusticum, persica, carthamus and lycium bark.
Well, you'd actually drink that?
You'd be amazed at things that I swallow, Dr. Flynn. It's all to do with the yin and yang and the flows of chi energy. It's fascinating.
Does it work?
No, load of old bollocks.
Why is it I always get the nightmare problems? I bet you've already sorted out that waiting list.
Just awaiting the computer printout. Can't be that many names on it. Right, that's Mrs. Stanley's hernia all done. Come on, Flint, let's go. Bye, Gasman.
Dr. Noble, would you mind if I remove this wart? My sister had a birthmark on her face, and I removed it myself with very little scarring.
I didn't know you had any surgical training, Gasman.
I haven't. This was when we were 7. We used to like playing surgeons and patients together, until... Well, let's just say the police did not pursue charges.
I'd just leave it be, Gaff, man. In a rush.
It is an imperfection and it must be removed!
I'm trying to cut the surgical waiting list, not add to it.
You cut a list, but you won't cut a what?
Oh, just sniff some gas.
Nice. Can I have Mrs. Portland's notes, please, Judy?
Certainly, Doctor.
Great.
Ah, this must be the waiting list printout. No, just some lab results. Normal, normal-ish. Normal. Incompatible with human life. Probably better redo that one, Flynn. What's this doing here? It's a card for you, sister. Private and personal to be opened by Sister Hope only.
What?
Is that a hint of Old Spice? Second opinion, please, Flynn.
Blue Stratos?
High karate?
Give that to me.
Denim.
The contents of this card are on a strictly need-to-know basis. You need to know that if you so much as look at this, I'll hunt you down like dogs.
Rough.
Right, let's see, Sydney. This accident area here is a little suspicious. Like some sort of nut, probably hazelnut. This hazy shadowing here represents a soft center. Congratulations, Sydney. You have a lovely box of Thornton's hazelnut and caramel moments.
Oh, Mr. Ron will be so pleased. He's always wanted one.
No, wait. One of the chocolates is misshapen. It is an imperfection and it must be removed. I need a scalpel. I'm going to perform an emergency section. Problem, Sydney?
I wanted it all to be natural, Doctor.
Signed, your secret admirer. 8 o'clock tonight.
Hello. Just come to have a quick look at your leg ulcer, Mrs. Portland. Ha! Ha! That's looking really, good.
You okay, Dr. Flynn?
Oh, that ulcer, it's awful. I can't get that healed by the morning.
What about MDT? Use it a lot on leg ulcers in the States.
Methyl, dihydro, tetra.
Do you know what MDT is, Dr. Flynn?
Yes.
Do you?
Yes.
Do you?
No.
I'll explain it for you. Which side is the ulcer on?
Left.
Take off your left shoe and sock and roll up your trouser leg. MDT is maggot debridement therapy.
Oh, maggot debridement therapy. Of course.
You know what that is, do you, Dr. Flynn?
No.
Give me your hand. Imagine you have a big ulcer here.
Round and round the garden, like...
Then we take some maggots.
From a bit of rancid old meat or something?
From a laboratory where they're especially bred.
Of course.
Then we carefully apply them to the ulcer. And we cover with a dressing. And we wait. And we wait. And then, as if by magic,
There's a white dove.
the maggots have eaten away all the dead flesh and healed the ulcer. Then we just gently irrigate away the maggots with saline. And that's it.
About the shoe.
See the maggots?
Well, it's better be urgent, Noble. Oh, God. Doesn't look good, does it, sister?
No, very nasty.
I've seen a few before, sir, but never one this bad.
How long do you think that waiting list is?
18 months.
2 years?
5 years.
150 feet.
What?
I never imagined it could get so long, sir. I don't know what to do. Government target says maximum waiting list length is 100 feet. We've got to lose 50 foot to get a star back.
Not we, Noble. You. Focus.
Focus. Yes.
Well, even Flint could have done better than that, Dr. Noble, and he failed his finals. I'll bet he sorted out that bed blocker, though. Hey, Flint?
Yes. MDT.
Ah, methyl dihydrotetra...
maggot debridement therapy.
Excellent. Oh, Dr. Noble, why can't you be like our man Flint with bright ideas like MDT?
Was that your idea, Dr. Flynn?
Yes.
I'm not having maggots on my ward. Not after what happened with that tapeworm.
Well, any thoughts on the waiting list, Flint? My registrar needs your help.
No, I'll just leave it to me. I just need time to focus.
Right. I'll get some maggots delivered to you this afternoon. Well done, Flint. The nurses were very impressed.
Gas man.
Can't you hear I'm busy?
What do you reckon on this? Is an urgent delivery for Mr. Ron worth an ultrasound?
Let me see. No, this cannot possibly be a bomb.
You sure?
I was an army medic until, well, the indictments were never proven. Ah! Dirty, filthy maggots! Get out of my intensive care unit! Raus!
Oh, dear.
What are you doing in my drawer, Staff?
Just looking for a pen.
Try your pocket.
Oh, yes.
What are you doing in my drawer, Dr. Noble?
Just looking for a rectal thermometer.
Try your pocket.
Oh, yes. Ooh, that's helped me focus.
All right, Cook.
Right, I said.
I need a favour. Have you got any maggots?
Sure. How many?
No, not faggots. Maggots.
Maggots? Sure. How many?
Dr. Noble?
Oh.
Well, these don't work.
My maggots arrived yet?
No, but I have, of course, sorted out my waiting list problem. Want to know how?
No.
Like what you see?
No, they don't work.
Right, well, I'm just off up to X-ray.
Oh, you little beauties. You got anything I can pick them up with?
Here you are. Use these serving tongs.
Sorted.
Coast clear, Judy.
Yes.
Sister Hope, I've admired you from afar for some while now. Meet me tonight at the hospital entrance at 8 o'clock. I'll be carrying some red roses. Your secret admirer.
8 o'clock. I take it you'll be there.
Well, I may wander in that direction.
What are you two doing in my drawer?
Just...
Looking for a...
Thank you.
All right, Docs. I've got a letter for Dr. Noble and a special delivery.
Ooh, something for me. Perfume, chocolates.
Maggots!
Oh, good. These are specially bred maggots, Sid.
Let's have a look at those little creatures, Flynn. Mmm, ulcers. Tasty, tasty.
Let's have a look. These just look like normal maggots.
Yeah, strange, that. Mustache. Might see you later, sister.
Right, it's feeding time.
I think you'll find that waiting list is now 100 feet exactly, sir.
An excellent day's work, Noble. How did you cut the waiting list?
I just cut the waiting list. Amputated the other 50 foot, sir. That is now the waiting list to get onto the waiting list.
Oh, good work, Noble.
You want to come down to that casualty corridor now, Mr. Ron? I have an appointment at the hairdresser's at 5:30.
Right. casualty.
Follow me.
Another triumph for us both, eh, Flynn? Might have a coffee sachet in here somewhere we could share. What's this?
It's that letter Sid gave you earlier.
Oh, God. Oh, no.
What?
2 urgent referrals to our waiting list. My star's fading fast. Come on, we have no time to lose.
We?
Grab the list, Flynn.
I can walk. I can walk.
Right, what's the first referral?
It's from a GP. Mr. Hudson Park's aortic aneurysm has a 90% chance of rupture within 4 weeks.
Was the letter dated?
3 months ago.
Oh, Sid. Is that Mrs. Hudson Parks? Hello, I'm calling on behalf of Mr. Ron, consultant surgeon at the South Mid. Yeah, I understand your husband is on our waiting list for urgent surgery. Really? Yes, that is a terrible tragedy. I'm so sorry for your sad loss. Goodbye. Result! 1 down, 1 to go. The next. Come on.
Oh dear, this one may not be so easy, Dr. Noble. Could be a big operation. We haven't even got a bed. There mightn't be a free slot in theatre. The patient hasn't had his pre-op workup.
Enough, Flynn.
It's an official referral from the intensive care unit.
What?
A large mole on the chest. It is an imperfection. It must be removed.
Gas man. You're coming with me, Flynn.
Still looks like the patient's in the corridor.
Not a corridor, Mr. Ron.
A ward.
Officially opened as of now.
Oh, well done, sister. Not sure about the name, though.
Noble and Flynn, welcome to my world. Out of the way with your stick of feathers.
You want us to operate urgently on Mr. Thompson.
Thompson? What's that?
Patient? One of those warm pink things you attach the tubes and machines to?
No, still not with you.
Hospital number SM6578.
Ah, SM6578. Why didn't you say? The skin blemish bed 4.
Quick summary, please, Gasman.
PA TBP 120 over 70, PO 289, PCO 245.
No, why is he actually here in ICU?
Ah.
3 days post-myocardial infarction in the right-sided heart failure and a compromised renal function. He's been on a ventilator for 2 days.
Thank you, that's enough. Get back to your cleaning. It is very complicated. You surgeons would not understand.
And why is this mole so urgent?
It is an imperfection and it must be removed.
So how long has he had it?
First noticed 1845 hours last night. No previous record of it in the notes. There must be a very aggressive melanoma to grow at such a rate. Could be very painful in the future.
Melanoma? I'll never get that sorted out by tomorrow morning.
Oh dear, oh my.
Right, let's take a look, shall we?
It was his birthday yesterday.
Okay. What do you see, Flynn?
2 centimetre diameter discoid lesion, dark brown, variegated in colour, irregular surface with a well-demarcated, slightly raised edge.
Gasman, would I be right in thinking his relatives had a little birthday party for him last night?
Yes.
And did they bring any party food with them at all?
Yes.
If I may just examine the lesion. Pepperoni, I believe. Very tasty. Intensive care unit, the human buffet. And I, Flynn, have just earned my star.
Right, I'm off.
You going anywhere special tonight?
No, why?
Not off on a date?
No, just the bingo.
Oh, right. Well, you'll need a pen then.
That's a rectal thermometer.
Judy, have you a minute?
Is it important?
It's about Mrs. Portland. I'm sorry I took the credit for your idea of putting the maggots on that foul, fetid pussy ulcer of hers. And those maggots are really rancid, too. I mean, a stench. They must have been really hungry or they're already starting to chomp into that ulcer. You're not eating that. I mean, of course it was your idea and everything.
Yes.
You couldn't have Mr. Ron believing it was all thought up by just a nurse.
No.
So is there anything I can do to show my gratitude?
No.
No. Well, thanks for the crispy...
Actually, some flowers would be nice. Some red roses.
Red roses, sure. And maybe I could take you for a meal sometime, if you're not busy. Which you probably are, because you have lots of friends here, unlike me. Boyfriends, even. Again, unlike me, haven't got a boyfriend.
Tonight.
What?
Let's go out tonight. Meet me at 8 o'clock at the hospital entrance. Oh, but don't forget. Red roses.
Florist!
I just so wanted to thank you personally for what you did for my husband.
Before he succumbed to his illness.
Yes. God bless you, Doctor. God bless you.
We do try our best, Mrs. Howard. And I can't tell you how tasty those Thornton's hazelnut and caramel moments were. And you really shouldn't have brought me these wonderful flowers.
Sid? Sid?
All right, Doc. Been here long?
An hour.
I should have been here at 8. But I dashed as fast as I could, see? Was Sister Hope here then?
Sister Hope? Didn't see her.
Oh.
What's with her flowers?
They're for a patient. Here he is.
Thank you.
Why you got flowers, Dr. Flynn?
Oh, they're for the, same patient.
Thank you.
You haven't seen, staff nurse Judy, have you?
Doing a late shift.
Ah, right.
Mustache.
Mr. Ron?
Evening, Noble.
Hello, boys. One at a time.
Where is Sister?
Oh, sorry, I'm late. I was up all night.
Right. Well, the inspector will be here in 10 minutes. That waiting list still sorted, Noble?
Yes, sir, once I get my teeth into something.
Yes. And the new Ron ward is up and running, which just leaves your bed blocker, Flint. Let's go and see if those maggots have finally devoured all of that dead flesh once and for all, shall we?
Mrs. Portland, I'm afraid you're going to have to stay in here just a little bit longer.
Flint!